Hi everyone, welcome to my YouTube video. My name is Hertha David. If you are a returning subscriber, thank you so much for coming back. I hope you enjoy this video. And if you are new here, well, welcome to the, people always say like this gang, like ABC gang. So we're not a gang, we're just gonna call each other the Pantsula. So welcome to the Pantsula gang. Just yes. And so I hope you enjoyed. Please subscribe, doch, make me happy. Let me just smile. So please do subscribe, and I hope you enjoyed this video. So basically I wanted my videos to be more some of my videos to also be educational, and of course I would love to share some of my experiences and the things that I learned off the internet, since I'm an internet doctor, an internet mother, an internet sister. I'm an internet everything. So I hope the things that I've learned from the internet I can also share with all of you, and that you can just so understanding people, knowledgeable people. So yeah, so before we start this video, I want us to do a short exercise. I saw Ndeshi doing this and I think it was amazing. So we're just gonna say a few words of, we're gonna declare some things into our lives, whether you're a Christian or not, whatnot. We can just declare some of these things into our lives. So I'm shy. The first one is okay, so we're just gonna say it over. I'm gonna be, I don't want to be too fast, but I'm gonna try to pace my speed, if that's the right word I'm using it. Yes. Yeah. So I am beautiful, I am handsome, I am kind, I am loved, I am blessed, I am fruitful, I am productive, I am seen, I am respected, I am doing well, I am successful, I am healthy, I am worthy, I am gorgeous inside out, I am respectful, and I love others. Yeah, I think we can end there for today. So just in case I was a bit fast, you can just go back and then you can say it by yourself. So without wasting time, today's topic is yeast infections. So we're gonna talk about yeast infections, right? I want this. So I hope you have yourself something to drink, something to eat. I don't have anything today. I cooked rice, but I can't. People just think I have rice all the time, eh? But yeah, I just ate now, so I think I'm fine, and I can do 20 to 25 minutes of this video. So yes, yeast infections. First question, what are yeast infections? Yeast infections are common fungal infections caused by an overgrowth of Candida species of yeast, which is commonly known as Candida albicans or albicanus, right? So it is basically an overgrowth of a certain species of bacteria, I believe, which is known as Candida albicans, or that one, yes. So this can affect various parts of your body, and it can affect women, men, children, and babies as well. So it's very interesting. It's a very interesting, and maybe if I'm happy, if I see, I'll share my experience with when I too had a yeast infection. Yes. So sorry for screaming, guys. I think I'm just so excited. So God is so wonderful. Like, he's so amazing. And if we just put all our worries, all our anxiety to if we just tell it all to God and everything, he will surely give us peace. So it's beautiful, man. Okay, so let's continue. Yeah, then I get distracted. Yo, you see spirit of distraction. Okay, but let's continue. So I hope you all understand what yeast infections are. Now let us go to say, how can one how does one actually get a yeast infection, right? So when it comes to men, common ways on how to get a yeast infection is through eating certain types of food, including beer. Don't stop. I'm not saying stop drinking beer. I'm just saying beer, bread, what else? Beer, bread, and dairy products. They can actually produce high levels of yeast growth, which can then result into you having a yeast infection. And other things as well that can put you at risk of a yeast infection as a man is having a weak immune system, taking antibiotics, being uncircumcised. Why are you not circumcised? And you, Maria, you have your boyfriend every now and then. You are my sister. Tell your men to go and get circumcised, you know. And also having sexual relations or having sexual intercourse with somebody that has a yeast infection. These are all ways as to how you as men can get a yeast infection. And when it comes to women, same, antibiotics, because it makes antibiotics actually make it easier for the bacteria to grow. And then also hormonal changes. This can occur during pregnancy or during your menstrual cycle, because your hormones, you know, they change over time. You know, your mood swings, you know, they change over time. And having a weak immune system, you know, tight clothing, high sugar diet. You know, when you come on your period, you know, and then your boyfriend Paulus, he decides I love my girlfriend. Yes, he loves you, but listen, Paulus will bring you a box of chocolate, gawa worms, sugar worms, sour worms, sweetie worms. I don't know, he'll bring you all types of sweets. This high sugar intake, and it may make you feel better, yes, but then it can also contribute to you being at a high risk of getting a yeast infection. And okuikosha ya holy ketu itatu ikatushi kuikoheni kaishinge katu. Let me not include myself. Ma oshiri okuikohambela shivi unanengongepi okuipula ikengambela. Hygiene is very important, and if you don't practice proper hygiene, this goes for both men and women, you can be at a high risk of having a yeast infection, most especially if you are uncircumcised. Okay, and last but not least, menstrual products. Menstrual products is actually the reason why I had a yeast infection. Years back, I don't know, between my last years of high school and my first years of university, I remember I had like tiny bumps, it's like goosebumps down there, and I was so scared, and I couldn't tell my mother because I thought my mom would be like, "Aye, watame Murongo, are you having sexual relations, Murongo? Are you doing the A's and the B's?" My mother probably would have reacted that way. So I decided not to tell her, and I went to go see a medical practitioner. I'm somewhere near home because I had my medical card, right? And it was just because I already had a file open. I just paid like $20-something. It wasn't so hard. I saw the doctor. He didn't even look at me. He didn't look at me, this man. He just said I have a yeast infection, which he was right, yes. But then he gave me antifungal cream, right, which is used to treat yeast infections. And so when he gave me the antifungal cream, it was the type of antifungal cream he gave me is on the long tubes. The tubes are like this long. Maybe I'm exaggerating, but there's like super long tubes which you need to insert inside of the vagina, so that you can, like, it's like a syringe. You pull from the antifungal cream with that tube, and then you insert it inside the vagina, and then you release, so the antifungal cream can, you know, moist, you know, milky size your vagina, like how Paulus does it. But yes, we're not going to talk about that. So yes, basically, yeah. And then I got home, I looked at this tube, and I was like, you know, I was young and I wasn't even having sexual intercourse by the time. I was a pure virgin. I still am. I still am. But I'm saying that I wasn't even doing participating in the A's and the B's. I wasn't having sexual intercourse. So I was so scared as to how in the world do I have something like, do I have an STD, you know? But it was just yeast infection due to the menstrual products. So then because I was afraid to use the long tube, I didn't use it. And so I wasn't getting any better. But I don't like waiting for 100 years before I start fainting or before things get worse, especially if it has to do with my reproductive systems, because I want to have beautiful children one day, and my mom told me many scary stories. So I decided to go then take my Mobicel. I had a Mobicel by then. Took my Mobicel, I googled gynecologist in Windhoek, and I found a gynecologist somewhere in Eros. Beautiful service, such a beautiful service. He knows what he was doing. And so I made my appointment. I don't even know where I got $200 from, because I had to go open a new file, you know, at the gynecologist. So I went there, and you know, and as I was waiting, you know, there were pregnant women in the room. It was like everybody else was like big except me, and I was so scared and alone, you know, and I was now scared to like tell people what's going on with me, because maybe I didn't know that maybe I had an STD that is just appearing now. So I was so scared. And STD from where, even if I wasn't having sex. So then what happened? Is someone knocking? Please don't come in. I'm busy. Come back after 15 minutes. Sorry. Yes. And so then what did I do? Where was I now? Now I'm confused. Yes. And then I entered, then it was my turn to finally go see the guy now. And then I sat down and I told him that no, I have these tiny bumps, like goosebumps, very, very small bumps, around, not really around, but more like on my thigh part, you know, the way in gang, you're not entering the inside, but going onto my vaginal part or my vulva part. But I think I went too early or too fast. I didn't take that long. So then I was like, oh, okay, are you having sex? And I was like, no, I wasn't having sex. He asked me some health-related questions, and then he was like, okay, cool, go lie down on the bed, take off your pants, and I'll come see you in a few. So then within a minute, I was done undressing. I laid down on the bed, and I was like, my goodness, what if this man violates me? You know, I'm so young and scared and vulnerable. Anything can happen. And he didn't. He was such a good guy, no? Very professional. And he assured me that I'm not going to put anything inside of your vagina. I'm not going to enter your vagina. I'm just going to inspect the area of your top vagina or vulva. And yeah, between the two. So then he took some ointment. He rubbed gently. I didn't even feel anything really. And then he was like, oh, okay, you have a yeast infection. And then I dressed up back. I went back into the consultation. I don't know, into his karumaya. And then he was like, no, it's just a yeast infection caused by candida. He explained everything to me. I even went to go do more research at home. And then I was like, please don't give me the fungal cream, which has the long tube. And then he laughed at me, and I was like, no, don't worry, I'm not going to give you that. There are more creams actually that you can use. And then he gave me like a cream that you just apply. And I went home and I applied that cream. Within a few hours, I stopped. The itching stopped. I was comfortable. Oh yeah, and he did run a few tests also. Then I later found out that what was causing the yeast infection was the menstrual products that I was using. I was using scented pads, scented tampons, scented soaps, and he said I should stop using those things and I should rather wash my vagina with just warm water without soap even, and I should just keep hydrated all the time, and I should stay away from scented products, which I did. After 3 days, the tiny goosebumps gone, and I've never seen anything like that down there ever since my visit to the gynecologist. So I must say I'm very happy that I went early, or else the more that I'll tell you guys, especially in the men part, please go early. Don't wait for 2-3 months. If it's not getting better within 2 days, go back to your doctor. So let's continue anyways. Oh yeah, and in babies it's obviously caused by diapers, because yeast infections like moist warm areas. So if the diaper is obviously moist because the baby talk peace. So like if you take longer to change your baby's diaper, you are putting your baby at risk of getting a yeast infection. Okay, so tutsikileni. Third question. What the types of yeast infections? So you have an oral yeast infection, which can appear around your mouth area, the throat, and tongue, inner cheeks, you know, and they can be extremely painful, especially in the inner cheeks, because then how are you supposed to eat and also give your boyfriend head? I'm joking, guys. So these ones are mostly, they say it's white patches on now the tongue and the cheeks, and you know, all they're like white tiny patches. These are called oral yeast infections. And then you have the skin yeast infections, which can be in your inner breasts, I believe around this part, and in any skin that folds, even here, probably your knees, and if your stomach, you know, maybe even the chin. I don't know about the chin, but you know, if your skin folds, and respectfully, of course, and in between your fingers, and guess what? In your nails also. So you now, Malakia, your boyfriend, you're like, Malakia is like, baby, I really don't. You're telling Malakia now, baby, I want to have sex. Ay ngoto malakia mine halana kunanga losili ay malakia o hole ke ku no hole ngi ke ngi ina shikutu tingi malakia no te ay then malakia say no baby kasona ike okay ngi no halane te ke no nditira mana ndunya lana unyali ka ukanyali ke kamwe ke nangu yali ke baby. My sister, then you ndapandala na you're like, okay, one no kala possible malaki no kala po ende alita upengo 200 dang ndi kapando amekuku kusara molokante. Okay, so you are there now. Then Malakia takes his fingers, didn't cut his nails, didn't wash his hands. Malakia got the yeast infections from who? Maria, who he was with the other day. Then what happens? Malakia also does what? He transmits the yeast infections to you, baby girl. So, or maybe he didn't get it from Maria. I'm just saying, don't now go question your partners. I don't know, but I'm just saying these are possible scenarios that can lead you to having a yeast infection. Okay, now the last one, not the last one, the third one, it is the vaginal yeast infection. This one just causes, you know, the bumps, and they can actually, I believe, they can increase the longer you wait. Itching, burning is some stuff that you'll see. And then also it causes this from, if you take long, I did not see this teacher, but according to my research, if you take longer to go see the doctor, you can then they can start coming out discharge, a whitish type of discharge. I will explain it later. And obviously there is discomfort, because who wants to be itching down there and burning and all the redness and whatnot. And then the last one is the genital yeast infection. There are more, but I'm just gonna say 4. The genital yeast infection, which is more, which is in men now. And remember, 70% out of 100 women will be affected or can be infected with yeast infections in their lifetime. 7 out of 10 women can be infected with yeast infections over the time of their life, whether it was when they were babies, when they were teenagers, when they were what, you know, it can happen, you know, so it's a normal thing. And in men it's less, but it can be common. So in men, it's the same symptoms. I mean, it's the same type of things where you feel swelling, and then you actually, as a man, you can get papules or pupils or papules. It's basically bumps on the head of your penis. That's where the yeast infection is mostly is. And if you're uncircumcised, so it's mostly moist and whatnot. So imagine seeing an so these things, these things, they can be on the head of your penis, and then they can actually come out pus, right? Pus, which can then also cause some sort of uncomfortability when you are peeing, and also when you are having the A's and the B's, when you're having sexual intercourse. Okay, so yeah, so please, yes, get it treated. Now, what are the symptoms of yeast infections? Itching, burning, some swelling, even bumps, in forms of goosebumps, or even bigger if you're not fast enough. And when it comes to discharge, right, in both, I don't know if it's also male too, but then the discharge is mostly they describe it as a white cottage or cottage. Let me see. White, yeah, it is cottage cheese. Which is lumpy and creamy, right? And yes, lumpy and creamy. So then a big question that the biggest question that is, I think, mostly valid is, how do I know if I have a yeast infection or it's maybe an STI? So like I said just a few seconds ago, the discharge of a yeast infection is mostly cottage cheese like-ish, lumpy-ish, and then some STDs such as chlamydia and gonorrhea, the discharge is normally green or white, and so this is actually like a huge difference. So if it's not like this, then it might probably be a yeast infection, but I'm no health professional, so please just ndakompangi then ikipangilita muvegwaya nikipangilita vegwaya pamata omananga mara hopoike umale nanga nde pa 5 minutes, you know, and then teteke umbo wapangwa. And do yeast infections smell? No, yeast infections do not smell. And yeah, they do not smell, which is pretty cool actually. And I think I don't know, I never had an STD. Do STD smell? Imagine. You know, I actually used to throw up when I was in biology. And I hated biology in high school, and I would see like a picture of an STD. Oh, I would want to throw up. If any man just gives me a not a yeast infection, but an STD, I don't know what, I think there's a high possibility I'll be having a case. Even if it's just, guys, you cannot even say small. Gonorrhea, those things are not small. Those are, and then you still go back to cheating partners. You people don't scared anything. You don't fear God, you guys. You don't fear anything. Let me see if I left out anything. I think I said most of it. And also, yes, how can I then limit me getting an STI? So it is by using condoms or dental dams when it comes to, you know, the sexual parts of it. Stop kissing babies. Please stop kissing babies. Breastfeeding also. I'm not saying limit breastfeeding, but if you know that you have a yeast infection, maybe speak to your doctor on how you can perform better breastfeeding methods, if that's the right way to put it. And of course, change diapers more frequently, and yeah, stay away from tight clothing. Stay away from scented products if you are sensitive. This for both men and women. And what else? Limit your sugar intake. Practice safe hygiene. You know, when it comes to men, and you are maybe not circumcised, or even if you're circumcised, you need to thoroughly thoroughly wipe. No, not rub. You're not trying to rub your excess memories on your heart. You just wipe, right? So thoroughly rub your penis properly, so that it can be, I'm not saying dry, just rub, so there's not that excess moisture that can lead you to then having a yeast infection. And what else did I leave out? I know you see me. Oh yeah, can yeast infections be treated? I mean, can yeast infections be cured? No, yeast infections cannot be cured. They can only be treated. So they can be treated using an antifungal cream, which I spoke about before. And how long does treatment take? When it comes to the genital in men and vaginal in women, yeast infections, it takes about 1 to 7 days. When it comes to oral yeast infections, it can take 7 to 14 days. And when it comes to the diapers, it just takes 3 to 7 days. So please stick to your course, finish the course, whatever they give you, the antifungal cream, finish it up, and make sure that you get better, and stay away from, try your best to actually find out, speak to your doctor actually on what caused it, so you don't repeat the mistakes that you have been doing before. And yes, also don't forget to wear breathable clothing. Cotton underwear is also fine. Avoid perfumed anything. Practice safe sex. Limit antibiotics. And yes. So that's the end of my video, or this video. I hope you all enjoyed it. If I did say anything that wasn't right, or maybe out of context or whatnot, you can always say it in the comment section. And if maybe I missed out anything, or you have any more questions, please do feel free to say it as well in the comment section, and I can answer the questions in my next video, which I hope will be about pep and prep. You know, I'm just gonna be doing male and female. I'm not gonna be doing one without energy. So yeah, excuse me, we'll be doing our next video on pep and prep. So before I leave, please don't forget to get tested with your partner. I'm reading Namibian Confessions, you know, it's a page on Instagram. I love that page so much, very educational. And I see that people are practicing unsafe sex, and we live in an era where nobody will really tell you if what they have anymore, because people are trying to infect other people. I don't know why we are trying to do that for the world. Do people even understand the effects of HIV? You know, like if we go back to how it was in 2001, do we understand the effects it will have on the Namibian economy? But yes, don't forget to get tested. You can always go to the Be Free Youth campus, or you can always buy like these ones you can actually get them free at the clinic, but they're always like out of stock sometimes. So you can get this at the government clinic for free, or you can buy the self-testers. I think it looks something like this, the U-test, early detection, early intervention, in the pharmacies. I believe these from the pharmacies. So it's very easy, and they all have like everything that you need to test for HIV. It's like the one that they prick. And then this one is the one in your mouth. No, don't just use your mouth to lick people's private parts and to suck people's private parts. Use your mouth also to test for HIV if you know that you are practicing unsafe sex. So until then, the Pantsola gang, I will see you all in my next video soon. Hopefully I'll upload it by in 2 weeks. And also something, I hope to vlog okay, let me not say. So yes, do have a beautiful day and or beautiful rest of the week. Until then, it's ciao ciao. Oh yeah, and don't forget to subscribe and like and do all those things that other YouTubers also say when they like finish their YouTube video. Yes, so it was nice, it was lovely. I hope you learned something, and see you all next time.